PCOM Perspectives. I'm your host, Dr. Jay Feldstein, and today we're talking with Jim Matney, CEO of Colquitt Regional Medical Center in Moultrie, Georgia. Mr. Matney has been an advocate and supporter of PCOM's expansion into South Georgia since it was merely a concept. He was the chair of the South Georgia Medical Education and Research Consortium, a partnership of 5 independent healthcare systems in South Georgia, including Colquitt Regional, that agreed to develop a feasibility plan to bring PCOM to the region. Since PCOM South Georgia began its first academic year in 2019, Mr. Matney has encouraged local community organizations and government agencies to support the mission of PCOM South Georgia. Now, in our 4th academic year in South Georgia, many of our medical students are completing their clinical clerkships at Colquitt Regional. The hospital is also home to Georgia South Family Medicine Residency program, which currently has a few of our PCOM Georgia graduates completing their residencies. I'm proud to welcome a great partner to PCOM South Georgia, Jim Matney. Welcome, Jim.
Hey, Dr. Feldstein.
How has the healthcare landscape in the region changed since PCOM South Georgia was established?
Well, you know, Jay, I think it's an exciting time. Typically a DO student is a non-traditional type learner. Sometimes they're older, sometimes they're different careers. And just to see the energy around PCOM is amazing. And I can tell a story that I asked somebody to help me. We've got a student that's graduating this year named Christian Edwards that was a full-time pastor at a local church. And when PCOM announced they were coming, he decided to go back to ABAC and get all his prerequisites. And he's going to graduate now this year in the first class. Just to see all the different people interested in healthcare and interested in becoming physicians is exciting. I bet I get a call a month from somebody wanting me to sit down and talk to them about how do they start the process of going to medical school. So it's real exciting times.
So what kind of impact has our partnership had on the area?
Well, you know, it's been multiple impacts. And me being the finance person, I like to look at economics. And if I look at just the sales tax collected, that's one, and I can talk about other things too, but just sales tax collected in 2019 versus 2021, even during the pandemic, and sales tax collection has gone up $2.7 million. Now, the sales tax is only 8 cents. So you can imagine the economic impact of having PCOM here has been. Besides that, just the number of restaurants, the number of housing, the number of folks that have come here. And I think the one difference for me as a hospital CEO is the ease in recruiting physicians to come to Colquitt Regional Medical Center. People like the fact that there's a med school here, and they like the opportunity that they'll get to both be a physician and also get to teach students and residents. So it's just been a significant difference in our recruitment to be able to have a med school here.
And what excites you about the future of healthcare in Southwest Georgia?
You know, being a little sentimental, it's the people. But to see so many students from South Georgia and from the state of Georgia to be able to go to med school that wouldn't normally be able to go, it's just been amazing. And the future is it's limited by what we can dream. There's a little video that one of your students, your second year student, put out, and they asked all the second years what they wanted to be when they graduated. And you heard orthopod, you heard psychiatry, you heard plastic surgeon, you heard dermatology. And those are the needs that a lot of hospitals need. And to know that we've got a solution in the future is just so reassuring that we've got a bright future here. You know, one of the things that I got, Jay, is how many students are actually from Georgia that are at PCOM South Georgia campus?
I think it's close to 70%.
Which would probably be over 100 students.
Yeah. So it's a large percentage because that's part of our recruitment commitment, is really trying to recruit people from Southwest Georgia and rural Georgia.
How important is it for hospitals and physicians and medical schools to work with PCOM, both the South Georgia campus and the Suwannee campus? I know we talked about, it's not just about physicians, there's physical therapy rotations, there's PA rotations. How important it is for hospitals to do that? I know the benefit because it's amazing the number of people that rotate actually end up wanting to stay in the area, but how important do you think it is for hospitals and physicians to work with PCOM?
Well, we have a very selfish perspective from that, in the sense that we can't be successful unless we partner with local hospitals and physicians. Our students need experiential training. They need to be in hospitals. They need to be in doctors' offices. They need that to be successful, not only in medical school, but in practice. And it's a very symbiotic relationship because it allows us to grow together. As you said, when you have medical students and residencies, it makes your recruiting to staff your hospital and also to recruit for your local communities for economic development that much easier. Most people don't like to come to an area for a job if there isn't a hospital, if there's not adequate physician supply. It's important in their decision-making process. So we all grow together. It's the most win-win opportunity there is in healthcare.
I really feel like the PCOM has just benefited the hospital a lot, but how is it that you feel that the Colquitt Regional has benefited the college and the region?
Well, you've been an amazing source of clinical rotations, experiential learning, residency development, and you've allowed us to fulfill our mission. One of our goals in our mission is to be a healthcare provider and educator for rural underserved communities. And, we do it from the urban perspective, but this is really allowing us to satisfy and grow our rural mission.
Jay, I've spent my whole entire career in rural hospitals. And one of the things that we did in rural areas, we recruited physicians from out of state or even from out of the country. And a lot of times they would come and stay 2 or 3 years and leave. The one thing that I think really has benefited this rural hospital, and it could benefit all the rural hospitals around, is that you're getting a physician that trained here. Lots of times will now be able to do their residency training here, and that will stay. And I think that looking at the horizon out there, being able to say, these students trained at PCOM, either South Georgia or Suwannee, came into our residency, and now they've been in the region for 10 years. I think it's just going to be a very good measurement of the success of this venture.
No, I agree. And also, we have been in Georgia for close to 15 years, but it wasn't until we opened in Southwest Georgia that the state legislature really took notice. Mm-hmm. Because we were doing something that everybody else talked about, but no one else had really done, which is to put a medical school in a truly rural community with the goal of recruiting people from the local rural area, to allowing people that go to college, whether it's at ABAC or whether it's at Valdosta, to be able to say, I can go to college in rural Georgia, I can go to medical school in rural Georgia, I can do my residency in rural Georgia and practice in rural Georgia.
And the misconception about rural areas is that you don't learn the same medicine you would in a bigger city. And my doctors tell me a different story. That people get sick in rural areas versus metropolitan areas with the same disease, cardiac, respiratory, and all that. But when you're in a rural area, you're it. So you really get to practice the whole spectrum rather than always constantly sending somebody to another specialist. When you come out of, when you work in a rural area, you take care of the whole patient. And I remember a doctor that had graduated from PCOM that was doing hospitalist work here. And he said, I like working at your hospital because I get to be a doctor. I get to take care of the whole patient. Well, we could sit and rest on what we've accomplished, but what's your plans the next 5 years? I'm sure you've got some.
Well, we know we definitely want to grow the DO class in Moultrie. We also want to look to add programs that the area really needs. So you alluded to earlier physical therapy. Can we send more physical therapy students for clinical rotations to Southwest Georgia? Can we send more PA students to Southwest Georgia? And then hopefully we figure out with you and the community what additional academic programs that are really going to benefit the area, and we'll add them.
I think it really is important that PCOM takes that posture that what is it you need, and we're going to try to fill that, and we felt that way. And I remember talking to you a few days back about we had a deficit of physical therapists and we just couldn't get people to hear. And it just took one phone call, and now we're setting up an opportunity to set up more of those rotations. That type of responsiveness is just welcoming down here.
Well, Jim, I want to thank you for joining us today, and I want to thank you for everything you've done for our partnership. Without you, we wouldn't be there. And without the support of our local communities and regional partners, our expansion into South Georgia would have been difficult, maybe even impossible. But because of our shared vision for the Southwest Georgia region, we're able to truly address the need for healthcare professionals in rural areas. To listen to past episodes of this podcast and become a subscriber, visit our SoundCloud page or find us on iTunes by searching Philadelphia College of Osteopathic Medicine. I'm Jay Feldstein, and this has been PCOM Perspectives.